Hey, good morning, everybody. We're going to be doing this video in lieu of all staff. We'll try to get through this as quickly as possible. We'll be posting this on Sniff Clinic for you to be able to sign and acknowledge as well. So for our monthly, how appropriate, because we're currently in a COVID outbreak that started on the 9th. We're going to be going over some infection control. So I'm just going to be reading what our infection preventionist has written. But for our COVID outbreak, just to give you an update on that, we've had 3 residents that have tested positive. We currently have 1 that's in the hospital. We've had 7 staff members in total who have tested positive. So we're still testing twice per week. Got to make sure that we're wearing the appropriate PPE in those rooms that have been identified by the appropriate signage. If we have no more positives, and today is the September the 9th, we can get out of these N95s and come out of the outbreak effective the 24th of September. So that's it for our COVID update. Some other housekeeping items I just want to put out there, and this is from laundry and linen compliance reminders. We've also posted this information in communications. The expectation is that you are reading communications each and every shift. Labeling clothing. All new residents' clothing must be labeled with first and last name, not room number, due to frequent room changes. Trash versus laundry. Trash must be placed in trash barrels, not in the laundry barrels. Checking laundry barrels. Inspect all linens before sending to laundry. Trash wipes and personal items are being found and are causing equipment breakdowns. We can't afford for those equipment breakdowns, and we don't want equipment breakdowns. Soiled linens and clothing. Please rinse linens and personal clothing with BM before placing in linen barrels. Laundry staff will return unrinsed items, and permanent stains damage can occur. That's the reason why we have the hoppers, and for you to be able to clean out that soiled linen. Pillows at time of discharge. Pillows remain in resident rooms for housekeeping is sanitized. Do not return pillows to laundry. Linen use. Do not hoard or discard clean linens into dirty barrels. This prevents closets from staying stocked and slows laundry. Stock linen closets appropriately. Proper linen disposal. Do not dump linen bags on the laundry floor. All items must go directly into laundry barrels to avoid state tags. We need everyone's compliance with this. And one more item that's not on this list is making sure that we're not throwing linens away. That's really important as well. So for the information for infection prevention and proper use of PPE. Infection prevention impacts all aspects of resident care and is also essential to many aspects of employee well-being, workplace wellness, and visitor safety. By implementing effective infection control measures, we can prevent the spread of diseases, protect vulnerable populations, and maintain a healthy environment. This is particularly important in hospitals and healthcare settings where vulnerable individuals may already have compromised immune systems. It is important to understand that infection can be caused by various microorganisms, such as bacteria, viruses, fungi, and parasites. These pathogens can be transmitted through direct contact, airborne droplets, contaminated surfaces, or vectors such as mosquitoes or ticks. Without proper infection control measures in place, these pathogens can quickly spread and result in outbreaks and epidemics. Residents in long-term care facilities are at increased risk of infection because of congregate living, staffing turnover, dependence on others for cares, poor immune systems, and many other issues. Infection control is essential because it helps in reducing the risk of acquiring and transmitting infections. The infection preventionist role is to maintain and develop infection prevention and control programs to aid in the best infection prevention for the facility and the residents. This involves daily rounding of the building, monitoring proper PPE, and audits of staff and departments for educational needs. The best way to help spread infection is hand hygiene. So that's the best way to stop the spread of infection, is hand hygiene. Number 2 is proper use of PPE. Our 4 signs to look out for: yellow enhanced barrier precautions, step up from standard precautions, gloves, gown for high contact care, and face shields as needed. Used for rooms with catheters, IVs, large wounds, and other inserted devices. Orange, contact precautions, gloves and gowns before entering room, and use dedicated equipment. Used for rooms with highly drug-resistant organisms, ESBL, scabies, lice, wounds, and uncontrollable drainage. Brown, contact and enteric precautions, washing hands with soap, gown, and glove before entering room, and use dedicated equipment. Used for rooms with acute diarrhea, C. diff, norovirus, rotavirus. Green, droplet precautions, hand hygiene when entering and leaving room, and wear a mask and eye protection. Gown with close contact care used for rooms with influenza, some types of bacterial meningitis, pertussis, respiratory viruses, and mumps. PPE don and doff. On. When you put PPE on, you're donning. You are washing or gelling hands. Gown if needed. Mask. Eye cover if needed. Gloves if needed. To doff, which is off. Gloves if used. Eye cover if used. Gown if used. Mask. Wash or gel hands if used. N95 masks. If you have not been fit tested, please complete this as soon as possible. Mask must always have two straps. Two straps. As you can see, I'm currently wearing it this way, but if I was to demonstrate the two straps, it needs to go one underneath and then one over the ears. That is the proper fitting for an N95 mask. KN85 not allowed unless medically approved with an MD note. So that requires a doctor's note. Vaccinations, another good way to prevent the spread of illness. Please sign and give IP a declination form on IP bulletin board or provide flu and COVID vaccine record when done. So if you have not, if you're not opted for the vaccine, you need to sign the declination form, and that is found on the IP board that is right in the front on the 300 hall outside of the RCM office. All right. So a couple of other items that we have coming. We did have a complaint survey. We did receive a tag. It was expected that we were going to receive the tag. This was the fall with fracture with the staff member not following the care plan. That was a harm level tag. However, we did what we self-identified and we alleged past non-compliance. So we will receive a civil money penalty for that. That is a harm tag. That's something that we were anticipating. But that's the reason for importance of educating and making sure that we're following through. Our civil money penalty exposure was quite limited. In fact, it was only 1 day because we jumped all over this. Another update, we have a new scheduling software that we are in a beta program right now. It's a beta program, and that is called Schedule Pop. You've already received your invites. We are actively using this right now, but we are still using UKG as a backup. So we're using both systems, and this is just a beta at this time. But Schedule Pop is going to be where you will find your schedule at this time for the nursing department. This is specifically for the nursing department. I almost feel like I'm a news anchor here with the papers now in my hand. So for the employee birthdays for the month of September, we have Shannon Krakowski, Emily Burton, Olivia Rich, Melissa Albright, Jonathan King, Sabrina Thompson, Sonia Burgess, and Susan Umbugwa. For our tenure for employees, we have Jennifer Stone with 2 years, Andre Snurtson with 2 years, Danielle Cardwell, 2 years, Jashanique Broussard, 2 years, Morgan Palm, 3 years, Karina Duker, 3 years, Caleb Cardenas, 3 years, Brad Barrett, 3 years, Mary Taylor, 5 years, and Josh Liskey, who transferred over from Clackamas, has been with Avamere now for 14 years. Our Shining Star of the Month, we do have, they are voting right now. Our resident council is voting for a new resident council president. But the person that was selected by the current resident council, that goes out to Jennifer Stone. So Jennifer Stone, CNA on day shift, congratulations, you've been awarded the Shining Star of the Month and selected by the residents. So great work, amazing job, and the residents certainly appreciate you. The Employee of the Month, this is someone that is voted for. You do have to come to the Employee Appreciation Committee as well. It's not just the votes, it's also coming to the Employee Appreciation Committee. And this was awarded for Norma Yoakum. on day shift. Quietly excellent CNA for her positive attitude, dedication, and care to residents, continuous willingness to assist with any resident and staff member. She's not just helping residents, she's helping staff members. So this will be on SNF Clinic. There will be an expectation that you complete and you sign off, and you will get credit for this all staff. Make sure that you're following up on all of your SNF clinics, and please make sure that you are reviewing that communication board on a shift to shift basis. That is important. That's where we're putting out these updates. You also will be receiving text us, and you'll also be receiving messages via Now Schedule Pop as well. We appreciate you, grateful and thankful for the environment that we've created together, and thank you for doing your good work, and we'll see you next time, and hopefully in person.